All right, let's dive right in. We're talking about that orthopedic pain, you know the kind. That nagging, persistent pain in your back or your neck or your joints that just refuses to go away. You've done all the basics, but what happens when the basics just aren't cutting it anymore? Well, that's exactly what we're going to break down today.
So you've probably heard it a million times, right? Rest it, put some ice on it, go see a physical therapist. And you did. You followed all the rules, you did the exercises, you were patient. But here you are, weeks, maybe even months later, and that pain is still your unwelcome guest. It is so incredibly frustrating, and trust me, you are definitely not alone in this.
Now, it's really important to get this straight. Following those first steps wasn't a mistake. Not at all. It's absolutely the right way to start. But for a lot of people, it's exactly that, just a start. So think of it less like you've failed and more like you've reached a signpost on the road that's telling you it's time to take the next turn. So let's get into our first section here, when the pain lingers. This is about that critical moment when you realize that what you've been doing just isn't getting you the results you need.
You know, conservative care, that's things like physical therapy, changing up your activities, taking over-the-counter meds. It's always the first line of defense. And that makes total sense. It's less invasive, and for a lot of simple strains and sprains, it works like a charm. But if your pain is coming from something more complicated, maybe like a nerve getting pinched or some real joint damage, these first steps might just be putting a Band-Aid on the problem instead of fixing the root cause.
So how do you even know when it's time to take that deeper look? Well, that brings us right to section 2, listening to your body. Your body is constantly sending you signals. The real trick is learning how to understand what it's trying to tell you, especially when it's screaming that something more is going on.
Okay, let's use one of the most common issues out there as an example, low back pain. It's so easy to just write it off as, oh, I just pulled a muscle. But how do you know for sure when it's something more serious? What are those specific red flags that you should absolutely, positively not ignore?
Okay, this is really the key right here. Take a look at these signals. Pain that shoots down your leg. You've probably heard it called sciatica. Or that weird numbness, tingling, or even weakness. These symptoms are shouting that this isn't just about a muscle anymore. This stuff points to a nerve that's being irritated or compressed. Then you've got things like severe pain that actually wakes you up at night. Or if you have pain combined with a fever or losing weight for no reason, those could signal other issues. And I really have to stress this one. If you ever have loss of bowel or bladder control with your back pain, that is a medical emergency. You need to get help right away.
And recognizing those red flags, well, that brings us to the real turning point in your whole journey. This is where you pivot from just trying to manage it on your own to getting specialized medical help. This is where you start to take back control.
This chart shows that pivot perfectly. Over on the left, you've got the familiar starting line: rest, therapy, basic meds. But when that well runs dry, your path evolves to what's on the right. You move on to seeing a specialist, which leads to advanced diagnostics, and finally to a targeted treatment plan. Now, targeted doesn't automatically mean some big surgery. A targeted plan could be anything from specific injections to calm down an angry nerve to a new kind of physical therapy that's tailored to your exact diagnosis. The whole idea is to stop guessing and start creating a plan that's designed specifically for you. Okay, so what are these advanced diagnostics we're talking about? One of the most common tools can sound a little intimidating: nerve tests. But seriously, there's no need to worry. Let's pull back the curtain and decode what these tests are really all about. So, at its heart, electrodiagnostic testing is just a way for your doctor to check up on the health of your nerves and muscles. The key thing to get here is that it's a functional test. It's not just looking at a static picture like an X-ray. It's actually measuring how well your body's communication system, your wiring, is working in real time. I absolutely love this analogy because it just makes perfect sense, doesn't it? If the lights in your house start flickering, a good electrician isn't just going to stare at the light bulb. No, they're going to test the wiring inside the wall to find the real source of the issue. That's exactly what this test does for your body. That numbness you feel in your foot, the problem might actually be coming from your back, and this test is what helps the doctor find exactly where that wiring has gone faulty. And the process itself is really straightforward. They place some small sensors or electrodes on your skin, then a tiny little electrical pulse, which honestly just feels like a light tap or a little muscle twitch, is sent to wake up the nerve. The machine then measures how fast and how strong that signal travels. If the signal is slow or weak, it tells your doctor precisely where that nerve is being pinched or damaged. It's basically a brilliant piece of medical detective work. And all this information, it brings us to our final and, I think, most important section: your path to relief. Because at the end of the day, all of this is about one thing: empowering you. Because knowledge really is power.
So let's just quickly recap the big takeaways here. First, don't just put up with persistent pain. It means it's time for a deeper look. Second, learn to recognize your body's red flags. They are your most important alert system. Third, don't be afraid of advanced tests. They're just tools to get you clarity. And maybe the most important thing of all, remember that you are not just a passive patient here. You are an active, informed partner in your own health journey. And this is such a critical shift in mindset. Getting a label for your pain, that diagnosis, that is not the finish line. It's the starting line. It's the beginning of a much more productive, informed conversation with your doctor. The real goal is to use that new information to work with them to build a management plan that actually works for you and gets you back to living your life.
So I'll just leave you with this one question to think about. After everything we've just covered, from those red flag symptoms to what a nerve test really is, what is the one thing you've learned today that's going to change how you walk into that next doctor's appointment?